Imagine you are suddenly visited by the worst guest of your life, one who never leaves and causes you to suffer chronic abdominal pain, bloating, rashes, itching, a loss of appetite, even weight loss. These unwanted guests are parasites, and they remain with us by feeding off of our bodies. So what can we do to protect ourselves? Joining us with the latest recommendations for preventing parasites is Dr. Susan Evans, Chief of Dermatology from Cosmetic Physicians of Beverly Hills. Dr. Evans, great to see you again.
Good to see you too.
So this is a pretty disturbing segment. Parasites, we know that they live off of our bodies, but they're easier to get than some might realize. Is that right?
It absolutely is. It's so important that you make sure to have cooked food and to make sure that you're not coming in contact with it. And one of the best ways you could do that, of course, is to make sure you wash your hands and be really careful about what goes in you and your family's mouth.
Very, very important. So explain exactly what a parasite is.
A parasite is when two species actually are living together and the uninvited host, or the uninvited parasite, is actually living at the expense of the host's food, blood supply, and they're extremely difficult to get rid of. It's like an unwanted house guest or something.
Right, and how do these parasites enter our bodies?
It's various routes. In some cases, it's from wearing no shoes and bare feet, and you're coming in contact with feces from other animals that has the worms.
And do the worms then find, let's say, a cut in your skin? How do they actually come into your body if you say you accidentally step on a infected feces or something?
Exactly, that's exactly, they have a port of entry there, and that's where dermatology comes in. If the skin is not in good condition, if it's broken, if it's irritated, it's an easier port of entry, but it also comes in through food. Water that is not clean. That's why if you're traveling, you always want to take like bottled water or something. Uncooked beef, pork, sushi. And all of these are options.
So these parasites, especially the ones that are in water or food, are they so tiny that they're invisible to the naked eye?
Yes, they are. Yeah,
really?
What happens is whatever animal that it's lodged in the muscle of that animal. So when you're eating this raw piece of beef or raw sushi, you don't see it until it gets inside and starts multiplying in your GI tract.
And growing.
Exactly.
Eventually looking like this, which is really disturbing.
Yes.
So let's talk a little bit about these wonderful visitors that you brought with you here.
Yes, we have a nice array here for you.
This one is the broad tapeworm, is that right?
Yes, this is one of the larger tapeworms. This one is about 20 foot tall, or not tall actually, in length, and it's wound up here. This is not fettuccine, folks. This is actually a tapeworm that was living in someone's body. And again, this type comes from raw meat.
Just to put everyone at ease, including myself, these are all in formaldehyde, so they're all dead, right?
Yes, okay. Most definitely. There's no getting worms here today.
So is this is obviously not what it looks like when it comes into your body. This has grown over the course of what, a year?
Yes, and if you could see, there's like new segments. It actually gets in, latches onto your intestines, gets the blood supply, and continues to multiply, making more and more segments. It does it very rapidly. It could live in your body for 10 years or so.
You might not feel it?
No, you might not feel it. It sometimes makes itself known.
Do they cause weight loss?
You know, that's an old wives' tale.
It is? Okay.
And it might cause a little bit, but quite frankly, I'd rather just have a healthy diet and another way of losing weight than actually have that inside me.
And tell me again how you get these. Are these, you get them through food?
You get them through food. This is in raw meat, raw pork, freshwater fish, like salmon that isn't cooked. So as much as we love sushi and raw fish, you really should only eat cooked meat. And other ways of getting not this particular worm is if you're eating vegetables or fruit that have not been cleaned. So make sure to peel it, make sure to clean it before.
Very important. Now, are these other versions of the tapeworm?
These are other versions of flatworms that you can actually get from having raw meat, raw pork, raw beef. So, and the problem here is you don't know you have it and it's growing inside of you, so you got to make sure to be clean have all that cooked meat.
Now here we have the heartworm, right? And this is actually a dog's heart.
It is, and this is why you should get your dog dewormed or make sure that they're taking the heartworm medication, because obviously this heart would not be able to function with a whole chamber filled with worms like that.
Now, can people get the worm from an infected dog?
Unfortunately, that's the case. So this is why you never want your children to come in contact with a dog that has not been dewormed, or let them lick your child, or even cat feces or kitty feces for that matter.
So other animals can get this worm as well?
Absolutely, it sure can. So you want to make sure that the only animals you come in contact with are dewormed, and make sure not to come in contact with their feces.
Right, absolutely. Now, is this then in this bottle, is that the actual worm?
Yes, it is. This is a type of roundworm, and these actually can grow to big sizes. And this is not the most common roundworm. That would be pinworms that most children can get from just being around and not washing your hands after using the bathroom, and so on and so forth, and not proper disposal of diapers.
And Dr. Evans, is this the worm that grows inside human lungs?
Yes, it does. It can. What it is this one actually forms cysts outside of the GI tract. And your body's response is to form this large cyst around it. It could be seen on an x-ray as something like a cancer, and granted it's not a cancer, but it is worms, and it has to be removed carefully, the whole cyst, or else the worms can go loose and travel.
And how does that worm enter your lungs?
Again, it travels through your blood system and gets lodged, and the lungs is it's better than, for instance, the brain.
Oh my gosh. Well, does it interfere with your respiration?
Absolutely. You're going to have respiratory symptoms. They can get really large.
Right. Oh, so scary. Now, what are the treatments? What can people do if they suspect they may be infected by a parasite?
Well, if you're having any sort of GI symptoms, then you've got to go to your doctor, a licensed physician, and let them work you up. In addition to that, once they're able to examine your stool most times and decide that it actually is there, if you haven't already seen them visibly, then they're going to give you some anti-parasitic medicine, and that's what you should treat it with.
All right, and it's important to know that these parasites are everywhere. It's not just a third world problem.
No, this is a problem here in America, and you know, the more that you're cooking your food and making sure to wash your hands and your vegetables, and not sharing the same cooking board that you do for your meat and your vegetables, the less likely you are to have them.
Thank you so much, Dr. Evans, for this very, very important information. And you be sure to check with a licensed medical practitioner to see what treatment is right for you if you suspect you are infected with any kind of parasite. We'll be right back.